silent prayer. Amen. We can get the flag here. We have two flags. Bob's got his. And we
Got one on screen.
Can everybody see the flag?
Yes.
Yeah.
Okay, there you go. Tom, you want to lead us?
Yes, I pledge allegiance to the flag
Of the United States of America and
to the
Republic
for which
for
is
which it stands,
one
one
nation,
nation,
under
under
God,
God,
indivisible,
indivisible,
liberty,
liberty, and justice for all.
Amen.
Amen.
For all.
Play ball.
Okay.
All right. Well, now I would like to officially welcome Patsy Ziegler, our Blue Cross Blue Shield account executive. Patsy and I worked together a long time, both in terms of our chapter as well as the Federation. And I know we had the 2011, I think it was, Federation Convention here in Carolina Beach. And I remember that Patsy led a beach walk for a little exercise down to going north about halfway to the pier on the beach. And the beach is still there. It's been difficult to visit it so much, even though we're right here, 4 blocks away. It's been so crowded in terms of the virus, we haven't been going down there very much. And not too many masks. But Patsy's been with Blue Cross Blue Shield for 24 years and has been working with the federal account for 20 of those years. She's been an award-winning producer many times, and I understand in doing that she's always enthusiastic, she's always knowledgeable. I have called on her, as I think many of us, for advice on dealing with individual situations. She's always been most helpful, and usually it's worked out that she can't personally be here for our chapter meeting because there was a big government agency that she usually had to go to at the same time. I think it was normally the Salisbury VA Medical Center. But because it's virtual, we're very pleased that we have her with us today. Patsy's a grad of UNC, and is that in Chapel Hill?
Yes, yes, the real one.
The real one.
The one and only, huh?
They have a basketball team.
And
They have a basketball team.
she's been married to her husband Joseph for 29 years, and they have 2 young adult daughters. And any grandchildren yet? Or?
No, we were supposed to get married. The oldest one, she and her fiance were supposed to get married Labor Day weekend, and due to COVID, they decided to delay it because they really want all the elders in the family to come.
Sure.
Not just the young folks who want to party. So so they delayed their wedding, and hopefully we'll be able to have all the festivities in 2021. And then any day after that,
You're ready, aren't you, Patsy?
Yeah.
I am. Yes.
Put in your order.
I'm
Go ahead, Patsy.
trying to be patient about it.
The
But
floor is
thank you.
yours.
Thank you so much, Tom, for that kind introduction. I really appreciate it. I've enjoyed the chat with you all this morning. Again, I am Patsy Ziegler, and I am your Blue Cross and Blue Shield representative. And it's a pleasure to be here with you this morning, even on Zoom for a meeting. I wish we could reach out and touch like we normally do. have a moment together, but we're going to settle for this because it's more important that we all stay safe, right, and healthy. And from the conversation that we've had already, I know some of you have heard a good bit of what I want to share this morning, and I will yield for questions. I do have some information I really want to give you and make sure we're clear about, but I will yield for questions if you like for me to, or I can do the full spiel. You know, I'm flexible here. But I do want to say that when it comes to Blue Cross and Blue Shield and the federal employee program, Blue Cross has been the #1 choice of federal employees and retirees, and 99% of our members keep their federal employee program benefits with us, coverage year over year. And this year, as you can see, let me go this way. Can you see the 60 years behind my head here? That's a little Zoom background that I'm able to display in this meeting this morning. This year, we are celebrating 60 years of participating with the Federal Employees Health Benefit Program at the national level. As Tom said, I've been doing this for 20 years on the federal account, and some folks have had Blue Cross the entire time, and we just want to thank you for that. We want to acknowledge that because that's a big deal. And we do look forward to continuing our partnership with the Federation, with the state conventions and what have you. Unfortunately, Blue Cross has already dropped the bomb on us that we will be working from home through the end of June. And I know the conference is usually the first week in May, so that messes that up off the top. We won't be able to be there personally if you decide to gather, collectively at back at the beach or wherever you decide to do. But we'll do what we can to be there to partner with you to help sponsor you. None of that is changing. NARFE is too important to us to not have our participation with you. So keep us posted and we'll figure out a way to make it work. All right. And then when it comes to your local chapters, it's a pleasure to finally be back at a Wilmington meeting. I remember the last time I did one, we were in that Golden Corral. And my God, it must have been about 60, 70 people up in there.
Right.
And the folks was trying to eat, and I'm trying to out-talk all that clatter and clanking and everything, and make sure you had what you need. So at least we don't have those disturbances today. But yeah, they have had me going from one part of the state to the other because I do have 34 counties, and that includes that VA in Salisbury that he mentioned. I have Camp Lejeune and New River and all of Wilmington, and Raleigh is like my home county, even though I live in Durham County. But there are a lot of federal agencies over in Raleigh, and they keep me hopping too, as well as everybody else. So let me I'm gonna share my screen. I didn't test it earlier. I have a little bit of information I want to share, and I'm going to start with the rates because I think I heard in the chatter that y'all hadn't seen the rates in writing in host disabled participant screen sharing. Chad, can you allow me to share my screen?
Yeah,
Sir?
sure. Okay, where is that? This is the new one for me. Let me find share screen.
Can
That's
you make
not-
her a co-host?
Well, that's
If
what
you make her a co-host, that works.
Yeah.
that's what I was just looking for.
You have to set that up though ahead of time.
Actually, he can do it now. If you go to my name or my picture where those dots are, maybe there's a section
Yeah,
in
if
there
it's
that
set
says,
up, it will show that. But sometimes if it's not toggled on before the meeting starts, it won't allow for that.
Yeah. Okay, hold on.
Maybe it's not in your settings originally.
You tag me.
Or you could just make her the host and she can make you the host again.
Yeah, that's what I'm going to do right now. Do you want?
surely with all the technical skills.
Oh, I'm on this thing all the time. I have a lot of meetings I attend, and I teach online, so.
All right, right now, Patsy, you're the host, so you should.
All right, I'm in charge, y'all. Look, what y'all ready for me to? Okay. Yes. All right. What did I want to share though? Where's my file? Messenger. Oh, right here. I don't know what that's about, but we're going to go to this.
We have it, Patsy.
Can you see my screen?
We can.
Yes.
All right. Now, this is the Medicare and Blue Book that I would give out if we were there in person. And I can't even mail it to you because I don't have access to supplies for those kinds of things. But I do want to scroll on down here and make sure. Now this page is real important, but we're going to come back to that one. I want to get to, where are you?
Can we call somewhere, Patsy, and have that book mailed to us?
This book is available online.
Online, oh great.
And it's really easy to get to. In fact, if you go to our website, which is FEPBLUE, F as in Federal Employee Program, FEPBLUE.org, and I will send Tom the electronic files, and he can just forward it to everybody of what I'll go through today. But you can go to our website under what's new, and all that's out there. But here go the rates, y'all. Those of you who are wondering what we're looking at for rates for 2021, this is it. And when you retire, you pay your premium monthly. All of y'all know that. And it's deducted directly from your monthly annuity. So we start with standard option, and I'm not real sure where we stand in this crowd of 16 or 18 or whatever our number is. But if you are self-only on the standard option, your new rate will be $267.48. And anybody who wants to know what they're paying right now is $253.30. The plus one is $608.43, where it was $578.83. And with the basic option, the 111, the current rate is $164.55 a month. So it's going up to $170.31. And then if you have basic self plus one, the current rate is $386.99, and it will be $409.87 for two people. And I don't know if anybody leaped over to the Blue Focus, but those rates are quite a bit more affordable and are not changing. So the self-only on it is $115, and the self plus one is $247.55. Okay, so y'all got that? Anybody need to take a picture of it? That's what young people do. They don't write stuff down. They take pictures with their phones. Or make notes of what we're looking at until you can get you a copy of this. Okay, so these are the rates. And if you're wondering, it's hovering around a 5% rate increase for 2021. Okay. So do you guys mostly have standard or basic?
Basic.
Standard.
Basic.
All right.
Basic.
All right, so we got a combination of both. Okay, so those of you who have basic option know that you have the opportunity to do the Blue Health, the Medicare reimbursement account and get $800 back per person on your contract. Just got to prove that you have Medicare Part B, that you're paying for it. And so here's some information on that. Again, you gotta, if you're already participating, you do have to fill the form out again for the upcoming year to keep it going. And there are a number of different ways. You can go to our website, the fepblue.org, right, and get the form. There's a form for MRA, stands for Medicare Reimbursement Account. Print the form off, complete it. You can mail it in. You can fax it in. You can go online. There's an app you can do online called Easy Receipts app, where you can get at the App Store or the Google Play Store for the Androids. And you can complete the information in there. But no matter what you do, you got to prove that you're paying for your Part B. So if your Part B is coming out of your Social Security, and when Social Security sends out their statements, probably any day now, because we're in November, The COLA statement will show how much your Part B will be for you. You make a copy of that and attach it to your form, you're good to go. For those of you who may be CSRS and not really paying for your Part B out of your Social Security, if you're not getting one, some may be getting it deducted from the annuity. I don't know, but whatever the deal is, you need to provide some proof of that. The council checks, a copy of the credit card statement or a bank statement. But to find out more in terms of what it takes and how to get it in and when to do it, you can call this number, that 888-706-2583. And if it's two of you, like these couples I see sitting here, then you got to do the form for you and you got to do the form for the other person. Two separate forms, not just one. And they're and what they do. Was that a hand up, Bill?
Patsy, have they ever considered just making that automatic so people don't have to apply, or is there a reason they don't make it automatic?
Yeah, there's a reason they don't make it automatic, and that's because people are known to cancel Part B. And if you're not really paying for Part B, you're not entitled to this money.
I see. Okay.
So you got to provide proof that you are actively engaged with your Part B.
So it'll never become automatic?
Probably not. Mm-mm.
Thank you.
I mean, I can't say never ever, but definitely not for 2021. And the other thing is if any of you are newly retired, for example, and didn't realize you had the opportunity for this, or you had basic but you never got around to filling this out, you can still do it for 2019. It's not too late to get money back for 2019, as well as money in for 2020. It's $800 both years. They give you 1 year look back. So once we get to January of 2021, it's too late for 2019. Okay? Does that make sense?
Yes, ma'am.
All right, so this is real important. Unfortunately, this is not available for the standard option policy holders. I know y'all pay more and it'd be nice to have some kind of kickback, but this is a basic option benefit only. Okay? Now, the beauty of having your plans with Blue Cross as well as your Part B all set up and squared away is this page right here. And I'm gonna make this a little bigger if I can. Does that help y'all see this a little better?
Yes, ma'am.
Uh-huh.
All right. So the thing here is the header says is what you'll pay when Medicare Part A and Part B are primary. You're retired. So if you got your Medicare, that makes Medicare primary, and we are your secondary payer. You do not need any kind of supplement or any other policies that you have to pay for to go with what you have with Blue Cross. When it comes to your preventive care, all that stuff is covered in full anyway. So we want everybody to get their annual physical. We want everybody to do your pap smears and mammograms and, whatever they say is necessary, or for cancer screens and stuff, PSA exams for men and all of that. So there's no problem there. However, if folks don't have Medicare Part B, and for the folks that you left behind at the agencies, they have co-pays for all these services that you guys see these zeros for. So with standard option, it's still $25 to go to the doctor and $35 to go to a specialist. With basic, it's really $30 and $40. What we're telling folks who have Medicare Part B with these plans is it costs you nothing. So when you go to the doctor, you can now just give them your Blue Cross card, your Medicare card, and you can go on and sit on down and don't have to worry about pulling your money out because technically they can't bill you. We have a couple of things that I want to take a second and explain. We have what you see here, these virtual doctor visits through Teladoc. Teladoc is a telehealth program, which we use a vendor. Teladoc is the vendor that we use. And if you go through them for your basic stuff, I don't feel well, or and they can write you a prescription, you go pick it up. There's no cost for that. But we have this other thing called telemedicine. Now that COVID is out here, how many of you have had to do a doctor appointment over the phone where you didn't even get to come into the office? All right, I see one hand. Okay. That's called telehealth. And that's with your regular doctor, the one that's in our network, telemedicine. And that's with your regular doctor, the one that's in our network. So for those of you who have Medicare, there's no cost shares for those either. But that's something new that we have added with COVID, because we think that the doctors are going to want to keep that up. Now, if you need a real physical, which means you're going to get probed and poked, you're going to have to go in. That won't be a telemedicine visit. But certain things like, okay, I've been on this medicine for 3 months. How's it going? Do we, continue with this prescription or no? Am I going to write you the ability to keep it going? You can do that over the phone, or you can do that through a FaceTime or a video chat with your doctor. So they are going to allow those in 2021. They're going to keep that going because that was something that came about as of COVID. Okay? So be aware of that. Urgent care centers are for the folks who just sick right now, don't need really to go to the emergency room, can't really get a doctor's appointment, but I need something. Those are part of the benefit structure. Copays away for that. If we do get sick enough to the point where we have to have a hospital stay, all the copays away for that. So that helps. Doesn't matter if you're there for 1 day or an unlimited amount of days. It doesn't cost you anything on any of the policies. The surgery is waived. The surgeon's fees are waived. And they can be doing anything from scoping that knee to replacing the hip. And we know that gets pricey, right? But you have no cost shares for services like that. And then if you really do need to go to the emergency room and they let you in because, they've been kind of closing down the emergency rooms to keep COVID out or to only allow for the COVID patients and stuff. But there's still reason to go to emergency rooms. Somebody may break a bone. We might be out there in that yard and, doing the honey-do list and, I don't know, some bees get them or, a snake bite. Anything can happen, right? Depending upon what you got back there, and you need to run to the emergency room. Those things are covered in full. Somebody has an asthma attack or a heart attack, have an allergic reaction, covered in full. And then when it comes to the lab work, because they do so much probing and prodding and urinalysis and blood draws basically are the true words for that. Those things have no cost share either. When it comes to the x-rays. And starting in 2021, the chest x-ray is no longer going to be considered preventive. But y'all don't have to worry about that because of the Part B, that stuff is covered. And then when it comes to the more elaborate tests, like the MRIs, the CT scans, angioplasty, bone density tests, all these things are covered. You still will have 12 chiropractic visits a year under the standard option policy at no cost share. 20 a year with basic option, and that new Blue Focus only allows for 10, but I don't think we have much interest there. You get your therapy, so if we need the speech therapy, occupational therapy, or physical therapy, those have zero copays. Standard has 75 visits per person, where you can get them all on one therapy line, or you can mix up some occupational with your physical therapy, whatever, but you still get 75 total, and that is per person. With basic option, you get 50 total in a calendar year. So that's kind of the breakdown of the benefits in a nutshell. So I will pause and go back over this to make sure there's anything else I want to make sure y'all have seen. Oh, we got to go over the prescriptions. So let me get to the prescriptions. Any questions while I pull up the medicine? Got to talk about this, though, before I get to the medicine, since it's right here on this page. Covering things that Medicare don't cover, right, or doesn't cover. When it comes to the hearing aid, I don't know if y'all have heard, but those who were on the meeting last week did. We're going from every 3 year to every 5 year schedule. So you can still get the $2,500 towards hearing aids. And if you got your hearing aid in 2018 and you need another one in 2021, we're going to allow that. If you got it in even 2019 or 2020, we're going to allow the 3-year rule. But if you're just getting them in 2021, you got to hang on to them for 5 years. The only way around that, because there's been, just to be transparent, there's been a lot of fraud. We understand that as soon as you get ready to get to your 3 year, the vendors are calling you up, come back, get your new hearing aids. And you don't necessarily need them always. So what they want now, if you need them before the 5-year rule, you got to have medical proof, medical necessity, as they say. Not just the provider saying, come get them, but the medical doctor has to test it out and test your ears out and say, oh, yeah, it's time for a new set. If they don't, then 5 years is what you got to wait. Are we good on that?
Yes.
Awesome. Routine foot care. If you have a long-term condition such as diabetes, as it says here, your coverage will cover necessary routine foot care when Medicare won't. Okay, so when you combine it with what Medicare has, you'll pay nothing out of pocket for the treatments. Doesn't mean that those, what are those things? The orthotics that goes in the shoes, they don't cover those. But you can get the medical care you need for your feet. I'm not going to even touch acupuncture because that's really not a benefit in the state of North Carolina. It's so hard to find acupuncturists that are medical doctors for your treatment. You still get some dental care under your medical though. So if you have basic option, y'all should know that instead of 2 cleanings, you're entitled to 3 cleanings. No, that's not true. You're entitled to 2 cleanings under basic option per calendar year. And your copay is waived. If you have the standard option, we'll pay on a fee schedule, which means we'll reimburse you a little bit towards what you just went through. When I say the 3 cleanings, that's more on my dental supplement, and I'll talk about that in a second. And if you're brave enough to travel in the time of COVID, then you know that your benefits travel with you, so you don't have to pay for any kind of extra fees to be on the cruise or to go to this trip for medical care. Your federal benefits are more than enough. And the website that you see here, stilloutfepblue.org/overseas. If you go there, there's a number you can call. You can tell them where you're headed, when you're going, and they'll give you information about where your care is and what to look out for or who to contact should you get sick while something happens. And if you're on a cruise and you need to get airlifted back to Miami, for example, as the closest airport, those kinds of things are covered under your federal benefits. So again, those policies that they like to dangle out there, like you gotta have this, you gotta have this. Medicare doesn't travel with you when you go abroad, but your federal benefits revert to primary if something happens, so you still have coverage. Okay. So you ready to switch over? Let's talk a little bit about the medicine.
Yep.
All right. Okay. So now this is the one thing where the copays are not waived, right? You still got to pay for those medications, and you can get them through the mail. You can get them at the drugstore. And fortunately, the bulk of these benefits aren't changing. But if you take specialty drugs, there's going to be an uptick in what you pay. All right. So let's start with standard option. With standard option, your generics are $5. They are $7.50 for the working population. But for y'all, it's just $5 for the generics. And it can be less in some cases. Sometimes you might go get in and out of there with a couple of dollars. So we're going to take that. We're not going to be upset about it. The tier 2s are the name brands, right? Tier 3s are also name brands, but the tier 2s are the ones that are on our formulary. Tier 3s are not on the formulary, mainly because there's usually an equivalent, maybe another name brand that's cheaper or a generic that's available. So the tier 3s are just a pricey prescription. So the tier 2s at the drugstore, you pay 30% of the Blue Cross price. And I know by now that y'all know that when that gets a little high and you know it's a prescription you have to take every day, to switch that over to the mail order, right? Surely y'all are using mail order?
Yes, ma'am.
My friends, good to go. So mail order, generics are still 10 for 90 days worth. The name brands are still 90 for 90 days worth. Even when they're more expensive, you're saving that money. Blue Cross absorbs the rest. And the tier 3s, which are the pricier name brands, are $125 for a 90-day supply. Okay. With basic option, the copay is $10 for the generic brands. And that has been there since this policy came out. And again, if it's a little less, but I understand most of the time with generic, they want the full, with basic, they want the full 10. The tier 2s is a $50 copay for y'all, whereas $55 for those who are still working, still active, and have no Medicare in their life. So it's $50 for a tier 2 drug. And then the tier 3s have a minimum of $60, but then they can go up based on the 50%. Now that you are Medicare Part A and B, you have mail order with basic. We do not allow the mail order with basic for the working population. So you can get a 90-day supply for $20, or for the tier 1s, a 90-day supply for $100 for the tier 2, which is a nice amount. I mean, it's not as good as the 90 that the standard get, but it's okay. And then the tier 3s is an even with the 125. So where the change is coming in, the specialty drugs. Specialty drugs are those drugs for complex health conditions like MS and cancer and unfortunately things like that. They are concocted, compounded, inhaled, injected. Y'all who take them know exactly what I'm talking about. You can get specialty drugs at the drugstore. However, you can only get like a 30-day supply once or twice. After that, they are switching you over to the specialty pharmacy, because those drugs on average are, $1,500 for a 30-day supply. So that's a lot of money. So they want to make sure that it fits whatever your needs are before they go into allowing you to get 90 days worth or extended use of that. However,
I have one question.
Yes, Bob.
Under preferred retail, that's for a 30-day supply, right?
Preferred retail, yes. Those are the 30-day
right.
supply. However, you can get 90 days worth of the tier 2s and 3s, and it's still 30% of the total price.
Okay.
It's not just 30% of the monthly price. So in essence, they'll multiply it times 3. They'll let you get 90 days worth at the drugstore. It's not the same as getting it, the 90-day supplies through the mail. The huge savings come through the mail.
Still cheaper to do it through the mail. Okay.
For most drugs. And the other thing, thanks for bringing that up, because the other thing is wherever it's more advantageous is what you should do. You're not locking yourself into, I'm just going to go to the drugstore only. So if this drug is cheaper at the drugstore, that drug is cheaper at the mail, and you don't mind working all that out, we don't mind making sure you get access to these benefits. Okay?
Yeah.
All right. So the copays for the specialty drugs are going up $10 or $15. So where's the specialty drugs? Bear with me. Oh, specialty pharmacy. It's right here. Reading is so fundamental. Okay, so you can get a 30-day supply of the specialty pharmacy for $65 through standard option. This is standard option. And $85 for the tier 5s. Tier 5s are also specialty drugs, but they're not on our list. They're more expensive even still. So you pay a little bit more for those. And with basic option, the 30-day supplies are $80 or $100. Okay? So that's how the medicines will work out.
Patsy, overall, in what you just gave us there, maybe I started daydreaming or something, but maybe you said it. Are there big changes from last year in the other than the specialty?
Not for y'all.
That no change, no dollar changes.
No, for the folks who don't have Medicare, the one change is the emergency room for basic option has been $125. It's going to be $175. But for y'all with Medicare Part B, it's still $0.
Okay, I was particularly thinking about the drugs. The pharmacy.
So with the drug specialty is where the changes are. These
Okay.
copays are creeping up on you a little bit. I think it's a $15 increase.
Yeah, I guess what's got me confused is when I see $10 copay for tier 1 drugs, and I don't pay that when I go to get my drugs, usually blood pressure or statins.
Right, because you're paying less.
Why am
The most you can pay is 10.
Oh,
Some of those statins are free.
Exactly. Ours are free.
And the metformin is $1. So that's a benefit.
Okay.
But the most you can pay for your generic, they cannot charge you more than $10. You can pay less.
Excellent.
And
Okay.
certain drugs are less, even on basic option.
Thank you for that clarification. Thank you.
You're welcome. Thanks for bringing it up. What other questions do you all have for me?
Patsy, I have a question.
Yes, ma'am.
Under the dental care for the basic, it showed on your chart you pay nothing for prevental dental services up to 2 cleanings a year.
Okay.
Is that something new, or has that always been? Because it seems to me Chaz and I have not been getting reimbursed for our cleanings. I need to go back and look. But
You have basic option as well, Judy?
We have basic option.
Okay, so the real thing about basic is the dentist has to be in our network.
Oh, okay, that may be the case, then it isn't. I'll have to check.
Right. The copay for it for the folks who are still working is a $30 copay.
Okay.
But if the dentist is in the network and you have the Part B, we'll waive that for you.
Okay.
And I don't know if that's not quite new. If it's not, I don't think that they were doing that a couple of years ago. I think you still had your $30 copay if the dentist was in network. But if you're out of network with the dentist, and I know in the Wilmington area, the network for dentists was a little weak there. It's kind of gotten hopefully a little bit better over time. Marie is real good with knowing network, so I'll call on her if I need a little help on that. But I think that they finally are getting around to waiving it altogether with the basic option policy. But the dentist still has to be in network.
Okay.
Otherwise, it's your expense.
Yeah, I think we found out that she was not, but we've been going to her for so long.
You just like her.
We didn't want to change, so. But
yeah.
I'll double check that next time we go.
Mm-hmm. And maybe she'll have a change of heart and join the network.
Right.
You know, it's never too late.
Is it bad for them to join? Do they feel they don't get as much money, or?
Well, dentists have their own. It's not like the network of doctors. They are not as friendly about being a network. They want to be paid right then and there.
Okay.
And then if you get reimbursed, they tell the people, "We'll just pay her back because she's already paid me."
Right. Okay.
Mm-hmm.
Yeah.
That probably doesn't include x-rays though, does it? Or does it?
The x-rays have switched. There used to be x-rays per year when they were bite wing. Now the x-ray is more of that panoramic.
Right.
And you can get that, I think, once every 3 years.
Okay.
I think it's 3. It's definitely not more, it's not every year. But I think it's because I've been in that fight for a minute with my daughter, who's about to turn 26, and we're trying to get all kind of work done before she gets kicked off. But I think the panoramic is a 3-year, once every 3 year.
Okay.
Mm-hmm. Okay.
Patsy, with Medicare A and B.
Yes.
Then I've got the basic plan, Blue Cross Blue Shield.
Mm-hmm.
Do we need FedVip anymore?
Let's talk about FedVip, because that was going to be my next thing, and we're going to start with dental. Is that okay?
Yeah,
Sure.
I have a dent.
Yeah.
I just want to say that I have the basic, and they covered most of my dental, including my dentist put an $8 COVID surcharge on, which Blue Cross covered.
Blue Cross is covering everything COVID related right now. COVID came out. It is considered a public health crisis. So all claims that I'm aware of, the test, even if it comes back negative, is covered at 100% for everybody on our federal policies. If you want to test for antibodies and they, file it as COVID, yes. The thing is, though, is how do you say that? You need to, like LabCorp, for example, was sending out something about come do this, come do that, or whatever. It's got to be ordered by a doctor. You got,
Sure.
You know what I mean? It's got to have the prescription. You just can't be volunteering to do stuff. But if someone comes down with COVID and then they need to take certain medications, if they need to have a hospital stay, all that stuff is covered in full.
They cover anesthesia for dental.
Oh, now the anesthesia for dental you might have to fight for. Again, talking about my own situation, and I'm not federal, but I am Blue Cross of North Carolina. But yeah, if it should be covered, it falls under the benefit. Now the thing about dental under your medical, not the dental that has to do with what I got on the screen now. The dental that's under your medical is really your cleanings and the x-ray once every 2 to 3 years, whatever that limit is. It's preventive dental. If we need if we need work like fillings and extractions and things like that, that's where the supplement comes in. Okay.
Okay.
That does not fall under your medical. The only thing that falls under your medical for dental is the extraction of impacted wisdom teeth. And at this stage, I don't think we can claim that. Okay.
That's it. That's it.
Yes. Yes.
The dentist is charging a COVID PPE related fee every time you go.
Really?
Is that reimbursed?
He just said it was.
He said it was. I had not heard of that, but I do know that we've been covering COVID stuff. If the dentist is, first of all, dentist has to be in our network under the basic option.
I think he is.
All right. Hang on.
Well, I just want to say that Blue Cross covered my dental cleaning, etc., and then they did a second coverage for the $8 of the PPE surcharge. It was a separate coverage.
Okay. Well, I'll ask them if they'll file it for me. Thank you.
All right. I'm also sending a quick message to one of my colleagues. So it's the surcharge for COVID PPE expense.
Right.
At a dental appointment.
Right.
Okay. Well, if I get a response back, Marie, I will let you know.
Can
you all see, since I've changed my screen, I need to double check to make sure you can see?
Yes, ma'am.
Okay. So let's go to one thing that is changing that y'all need to be aware of. I'm gonna make this bigger. See here where North Carolina is in the middle?
Uh-huh.
All right. And what North Carolina has done, because when it comes to dental supplement for all of the plans in the FedVip program, we have what they call rating areas. It's not a flat rate for it like it is on the medical or the vision. In dental, your zip code matters. All right. So North Carolina will now have 3 rating areas. In North Carolina, if you have zip codes, let's say down here to 280 to 282, the first 3 digits, and y'all with the 284s, 285s, all the way down to the 289s, you are now in rating area number 2. All these used to be part of 1. They are now rating area number 2. And what they did for those of us that live up this way, if we're in the Raleigh, Durham, Cary, Chapel Hill, Goldsboro area, the 275s to the 277, plus the Fayetteville area of the 283, and my hometown area, Maxton, 283, we are now 3s. Okay? So y'all have been pushed up to the area 2. And I bring that to your attention because the rates for the dental didn't go up, but your rating area did. So if you have our dental and it's 2 of you on this policy, you were used to $34.63. No, excuse me, $75. Y'all are monthly. $75.03 a month. And what's happening, since you will be a 2, you're going to $84 a month for 2 people. If you had the high option, if you had the standard option, it was right at $40 and it's going to $43.53 a month. If it's just one person, $17.31 will now be $19.40, and the $9 will be $10.04. Okay. So the Wilmington, Jacksonville, Southport, I think all that's 284. Those are the first 3 digits of the zip code down that way. Am I right?
Yes.
Okay. You're going to the rating area 2. How about Hampstead? Well, what was that lady? Miss Marty?
Yep, I'm here.
So you're 284 as well over there in Hampstead? Okay. Yep. So make a note of this if you're interested in the dental, if you don't already have us. And I didn't say this earlier. Open season really starts Monday. It's November 9th, and it's going to run through December 14th. And I will also say if you're happy with the plan that you have, you don't have to do a thing. Anybody who wants to make a change will have to go through OPM on the medical side. And if you do want to do any kind of changing on the dental or vision, you go through benefits.com. So this is the rates, then that's the why. Now let's go back up here and look at the benefits, because you're not as fortunate with everything being weighed to zero like you are on the medical. But you do get the 3 cleanings a year that I was about to put on the medical side. Whether you take the high option or the standard option, both sides are entitled to 3 cleanings a year, which is nice to have. And as long as you stay in network, even a high option, we cover the whole thing for the cleaning. And if you're in network on the standard option, we cover it for the cleaning as well. If you happen to use dentists who are not in the network for the supplemental dental, then with the high option, you have a $50 deductible per person and a $75 deductible for being out of network on the standard option. And then if you're doing stuff like that oral surgery that's not covered under the medical, those fillings, if you need some gum scalings, the plan will pay 70% of the bill, no deductible, off the top, no waiting period. And the stuff that costs way more money, things like the nasty root canals, crowns, if you are interested in either the implants or the dentures, that's covered on a 50-50 split on high option and network. If you go out of network, we drop down to 40% as our share, and you have the 60%. If you go to standard option, we start off paying 35%. Okay? So that's something to be aware of. And if you are going to get something that's really expensive, let's say 3 or 4 implants, because those are pricey. If you are in network and you take the high option, we have an unlimited amount on our 50%. And it makes more sense when I say it like this. We know that an implant is what, $5 to $7 grand, maybe even more, depending upon what you need and who you go to. The 50-50, once Blue Cross gets to $3,000, we're done. So if you want 2 and 3 teeth done at one time, this will not work in terms of getting a good benefit from us. But when we say we'll pay unlimited on our side, there's no cap. Then you can do as much as you're willing to pay your 50% on, knowing that the other 50% is covered on this end. Okay?
Yep.
All right. So, and then in terms of enrolling, this is some examples and all that stuff. Benefits.com, and there's a toll-free number that you can call, remembering that open enrollment really doesn't start until Monday. So website is probably best, but it's 877-888-3337. And let me repeat that, 877-888-3337 is the toll-free number for enrollment information.
It's the same for the vision.
On dental. And it's the same number for the vision.
Noted. Same number for vision.
Okay. I'll pause for a couple of questions on this before I switch over to the vision side. Okay. I need to run the phone. Give it a second to pop in. Dental is a little slow. Please come. Don't do me like this today.
When does open enrollment end?
December 14th.
Thank you.
Mm-hmm. And then changes take effect on January 1. Oh, and the other thing I didn't say, which I know those who attended the meeting last week know, we changed the name of our dental and vision. Now it has Blue Cross in the name, which makes it easier to find. So it's it's BCBS, Blue Cross and Blue Shield FEP Vision, and Blue Cross Blue Shield FEP Dental. No longer Dental Blue and Blue Vision and Blue Dental, or whatever our names was. I'm so confused now. It's too much. So we're going with what it is, not worry about what it was. However, those of you who have the cards, it rolls over. Your card will still work. We're not going to send you a new card. They're not going to spend a lot of money just mailing out some ID cards. Okay?
Okay.
But if you lose your card and after a while it starts to be illegible, you can always call and get an updated one. Okay, so again, no rating areas for cost for our vision policies. So the monthly is where you guys fall. If it's just you, for the high option, it's not even $12 a month. It's $11.90 and $7.58 under the standard option. But if it's two of you, you're looking at $23.77 or $15.15. So it's very affordable, nicely affordable. And in terms of how it works, it's worth it, because the way this plan works is everybody's entitled to the eye exam, right? One per year, and you don't pay anything for that. And then you can get glasses at no cost. And they used to make you wait for 2 years for the standard option to get a new set of frames. They are waiving that starting in 2021. But they're going to give you a $10 copay for the glasses if you take the standard. There's no cost share for the glasses if you take the high option. So new in 2020 is the standard option folks will pay $10 for their glasses.
The benefit for glasses, suppose you get transitions or some other added stuff in there, is that covered also?
Yes, we cover transition lenses, the Verilux progressives. You see this here?
Uh-huh.
And what's this word? Crizal anti-reflective coating. And there was an example. Let me see if I can find it for you. All right, so here's an example. So if you go get some frame, go get your eyes examined, it's typically $100 cost for the exam. Waive if you take either a high or a standard. Frames, average retail cost is $150 unless you're in LensCrafters or somewhere. But we're covering up to $200 per frames going forward in 2020, not just at VisionWorks, but everywhere. And we're adding Target Optical to our network starting on January 1st. And Pearl Vision is being in our network starting January 1st.
How about the cost of prisms? Do you know what I'm talking about?
The cost of what?
Prisms in your lenses.
Prisms?
That's all right. Not too many people have that. Okay.
Yeah, I don't know. These are readers, but they're the good ones.
Yeah.
But what I want to say, if I usually tell the actors, if you got one of them rambunctious kids that breaks stuff all the time, including their glasses. But if y'all happen to break your glasses, you got a 1-year breakage warranty. You do have to bring the broken glasses back so that they can get replaced. All right. Lost glasses don't count. You got to start over. But bifocals, which many of us need, there's no cost share for that. The polycarbonate lenses, there's no cost share for that on both plans. The ultraviolet coating, there's no cost share for that. The plastic photochromic lenses, I don't even know what that is, which falls under transitions. This is where transitions falls. No cost for the high option. It will have a $65 copay with the standard option. And I think that's about a $200 cost that they add on. Well, here, it's $120 in this example. The anti-reflective coating, particularly for those who are on the computers a lot and cell phones, has a price of $125 out of pocket, but a $33 copay under high option, a $48 copay under the standard. And the premium progressives, which are nicer progressives with premium added on, and that's nearly $300, but it has a $90 copay. So glasses that could cost over $1,000 at one of these facilities, one of these retail providers, will only cost $123 if you have high, or $211 if you have standard. So you can save a considerable amount of money with the vision policy benefit.
Patsy, may I ask you a question?
Certainly.
If you want to stop, we have the Blue Vision, and if we decide not to continue it next year, can I do that online? I don't have to call?
Yeah, you can do it online at thebenefits.com.
Benefits.com.
Starting Monday.
Okay, great.
And then if you change your heart in 2022, and you go, well, you know what,
Right.
you can come back.
Okay,
The
great.
dental and vision, you can come back. Don't leave the medical.
Oh, never.
Hey,
Thank you.
Yes,
Patsy,
Bob, you're welcome.
is there a list of providers on the computer or what for the
Yes,
vision?
yes. If you go to BCBS FEP Vision, and if it's dental, then it's BCBSFEPdental.com. And in there, it has the providers. And it will give you based on, how far of a radius you're willing to drive.
Thank you.
You're welcome. All right, I am going to stop sharing, relinquish my ability to be in charge.
That's hard for you, Patsy. I'm sure.
Because I'm just like you, Judy. I tell you, I can feel it. I can see we are kindred spirits.
I think we discovered that in the past, haven't we? Yeah.
Put the whip away.
Listen to that. But yes, I'm gonna relinquish my control. But what other questions do you all have for me today? Yes, Bill. Bill's got his hand up.
Yeah, I just keep these Medicare Advantage and Medicare supplement cards. When you're in the federal program like we've just discussed, is there any reason ever be interested in those?
They're very attractive. And Aetna, for example, has one within the federal program. Blue Cross still does not. However, local Blue Cross, it has Med Advantage out there. And if you Google it, they have something for federal employees, right, where you can, what they want to say is add it to what you already have, because they got these $0 premiums for Med Advantage. And it has some nice little addities that we don't offer, like if there is a hospital stay, you can get 2 weeks worth of food, 2 meals a day kind of a thing. You get maybe a debit card to help with some over-the-counter prescriptions, up to about $25 per quarter or something. But my thing is, I don't know. I just think the prescription benefit is nothing to play with. They have some nice stuff for generics, but their formulary is not as rich as ours. So stuff that we call generics, they may call name brand. And you'll find yourself paying more money and that type of thing. So you just have to be really, really careful. And know that, because I want you to be clear, because I know people are going to be coming for you this time of year. They probably already started filling your mailbox up with stuff, calling your house, trying to get an appointment with you and everything. I know, I see you. Yeah, because my husband is Medicare eligible. We get a lot here too. The federal government will allow for you to suspend your insurance to try a Med Advantage, but you got to do it right. You don't want to drop it where if you get in one and you don't like it and you want to come back and you mess everything up. So what they're trying to say is just try it on top, right? Because what happens is you have to have Part B to do a Med Advantage. There's no way around that. And they take over all of Medicare and pay your bills or pay whatever, but you will incur co-pays for the doctor's offices and all kinds of things, and more expensive for prescriptions. So just because it seems real attractive, nothing is as rich as what y'all have.
Right.
And that's just the bottom line. Nothing is as rich as what y'all have.
What you mentioned was zero premium, that Blue Cross Med Advantage.
Mm-hmm.
Is it no premium for everybody? Is it something that everybody on this call should be getting for themselves, or?
And I think it's a zip code kind of thing. I'm not real sure if it's for that I don't know. I don't have enough information about them. I've been beginning to study up on it and getting more involved, more information, because I get a lot of questions and a lot of emails about it. Yeah, I don't know.
So it sounds like if you wanted to try that Medicare Advantage idea, that maybe you could save some dollar amounts in the premium, but at what cost? It would be higher drug costs and it would be some copays. Am I right? Did I hear that right?
Right. And then they have they back to the donut hole.
Oh,
Once
yeah.
Yeah, don't forget, they don't call it that anymore, but they still have that version of it where it covers medicine up to a certain point, and then you have to cover medicine, and then when you get to a certain point, then they go back to helping or whatever. So, yeah.
Okay. Thank you.
You're
And
welcome.
just one remark on if you do suspend your federal health benefits, it's only allowed once per lifetime.
Right. And you can only come back during open season. So like if you're in a situation where you wish you were back on your Fed benefits, you have to wait to open season.
Right.
And then you don't get back in until January of the new year.
Sounds maybe too precarious for me with my mental issue.
So the main thing then is one of the reasons we're promoting the basic so hard is because at least it has the reimbursement in there to help out. The pharmacies, Standard's got the best pharmacy, period. Almost every drug you can imagine is allowed on the Standard. So it has more of an open formulary. Basic has a managed formulary. So there are certain drugs like one of those acid reflux drugs. Give me a name like is it Lipitor or something? It's not covered, but the generics are. But if you want that, if the doctor, on the standard option, if your doctor says dispense is written, then Lipitor is still covered. So, so the drugs are a thing, and you see that Standard now has the mail order. Basic now has the mail order for retirees with Medicare, where it didn't when it came out about 15 plus years ago. So they are trying to keep keep Basic as attractive as possible.
Patsy?
Yeah.
I would say that we've had Basic for many years now and have loved it. If you notice the premiums, it's $200 a month less for Self Plus One than the Standard. Plus you get we get $1,600 back through the year. And we have noticed no difference. I think it's a great option.
Well, I'm glad you said that. Me too.
Yeah.
And I would be careful with Blue Focus because it has a lot of limits.
Oh, yeah. I'm not looking at that. I'm happy with what we have.
Yeah. I mean, it's definitely way more affordable, but it has a lot of limits. It
Right.
weighs a lot of copays, but technically you only get 10 visits to the doctor a year.
Well, maybe for the younger people, that's good.
Yeah.
But for us, we need to keep our options open.
Yeah. And the medicine with Blue Focus really doesn't cover nearly as much.
Right.
But you folks that have Standard, make sure you heard what Judy just said, because it's well worth you looking into.
Absolutely. Thank you, Bill, for confirming that.
Yep, sure.
Okay.
Thank you, Patsy, for being with us.
Yeah.
My pleasure, y'all. And
Enjoyed it.
It was
I'm
great.
gonna go stretch my legs and get ready for this 12:30. Okay. And
Stay safe.
again, Tom, I sent you the email. I'm gonna send it to you to Marie, so that I know you know everybody down in Wilmington that retired that hadn't had a chance to meet in the meetings. Help get the word out. So if anybody wants to talk to me again, y'all know how to reach me. And if you don't, Tom has all my contact information.
Right.
So let me hear from you if I can be of assistance. Okay. Again, it's always a pleasure. And I am going to sign off. Yes,
Bye,
Bill, did I
Patsy.
see one more hand up? Wait, Bill's still there.
Take care.
You're
Bye. Just say goodbye.
No, Bill got a question. We're going to
Bill?
listen to that.
Bill, go home.
I can't hear him. Does anybody know what he said?
Will you say your phone number one time, Patsy?
Oh, 919
Uh-huh.
765
Okay.
4324. That's my direct line.
Thank you very much.
And it rings here at the house, so we're good.
Wow. We'll put that in the minutes.
Bill, the other Bill, you got a question? Was that a buy or a question?
Just a quick question. On the refund, the $800 refund, do both of us, I have to sign up for both of us, not just one?
Right.
Yes.
And separate
Forms for both.
envelopes. And you got plenty of help on the phone. As I get off, they can help you with that. But yes, you do need to fill out the paperwork per person in separate envelopes or fax it separately. Okay.
Right.
Okay.
Thanks,
All right,
Pat.
y'all. Thanks for everything.
Bye, Patsy.
Appreciate you.
Bye.
Bye-bye.
Make sure you turn it back to Glenn.
Oh, I think, wait. No, he gave it to that. Oh, whoa.
I think you said you.
I already got it back.
Okay.
Okay, you can go, Patsy.
I was like, okay, wait. All right.
Is Tom anywhere around to start the meeting?
I'm right here.
Can we get going?
Yeah, we're trying to, I think Glenn has sent a link to Henry Bradley,
But he's
Our
far
phone.
down in the agenda, so can we get started?
Yes, we'll get started right now. Opening the business meeting. The minutes were sent out by email. Can I have a motion to approve them?
I make a motion the minutes be approved as sent by email.
Second.
Any objections? If not, hearing none, the minutes are approved. The treasurer's report, Glenn.
All right. Currently in our account, we have $5,278.78. And no major expenses.
Quiet month, huh?
Yeah, for a while.
Yeah, we're not spending too much on gas and entertainment or anything. Okay, just a moment here. Legislative report, and Don I don't think Don is just back with us, but we obviously don't even know the outcome yet of the presidential election. My understanding is that two of the congressional seats in North Carolina have gone blue, so perhaps we'll have better representation. I don't know which two those are. It's not in the 7th district. Whoever gets in, there's still going to be a real focus on having to control entitlements and deficits and so forth. That's going to come back at some point, and we're going to have to be very vigilant, I think, from now on in protecting our healthcare benefits and so forth. Also, the budget will be coming up in December. They'll have to do another continuing resolution or get a budget passed. We could be looking at another shutdown. So it's going to be really important to pay attention to the website, through your magazine, to be on top of the legislative things. Judy, you want to do NARFE report?
Yes, the cycle, the way they do it, it's the January 1st, 2019 through September 30, 2020. The goal was to raise $1,750,000, and they actually raised $2,100,000. So they were very pleased to raise more than they had anticipated. During that cycle, over 31,000 NARFE members contributed. And in our chapter, 24 members contributed. I imagine most of those who are on this meeting call were the ones that part of that 24. So I say thank you to all of you. And if you haven't given yet this year or any year, please do so now. We need more than ever the support, and the PAC money is very helpful to keep our benefits. So keep up the good work and keep on donating when you can. Thank you. And I don't have any sunshine. If anybody has any sunshine to share, please let me know.
Any birthdays or?
Oh yeah, any birthdays or anniversaries in our small little group here?
Actually, there is one birthday.
Oh, yeah.
Cheryl's birthday is coming up.
Okay, well, as her birthday present, we will not sing to her.
She's fine with that.
But we'll wish her happy birthday.
I want to welcome our guest, our new president of the Federation, Henry Blatley, has joined us, and he's going to, at a time, help swearing in of officers. Welcome, Henry.
Hey, Henry.
Thank you.
And membership. Fran and Walt, do you want to say anything about membership?
On the membership report, it's very brief. It just indicates we have 4 members that renewed their status and 1 change of address and phone number. That's it. It's a very, very brief report.
Wow.
Have they ever gotten the thing straightened out so you can trust the reports?
It's still a challenge.
Okay.
It's improving, but there's still a ways to go. Henry, do you want to comment on the reports?
We had some reports here, and just bear with me 1 second because I wasn't doing what you were talking about there, but I just had something that I sent out to everybody, and I'm just looking for what I sent out. I had the percentages for the nation and all right.
While you're looking, Henry, I just want to mention again that there are incentives that email was sent out. So if you can find any of your former colleagues or anyone that would consider joining NARFE now between a rebate from nationally and from the Federation, you can have about half of it covered. And please contact Fran and Walt, or you can contact me if you have a situation where that would fit.
They're going to have new registration forms with the new amount of dues.
I think that goes in effect the first of the year. I assume they will in the magazine or on the website.
A good reason to prepay your dues if you're not, even if you're on dues withholding, you could still prepay it and get the lower rate.
Right.
Okay, Cheryl, do you want? Cheryl's going to give her report here. Or did you find what you're looking for, Henry?
No, I'm still looking for it, unfortunately.
Okay. I'll go ahead and give the report. We have Patsy speak today, and then a week from now on November 12th at 2 p.m., there will be a presentation on the NARFE website and comparing the different federal health plans. James Marshall will be presenting it. There was one webinar, to be or not to be Medicare Part B, is it right for you? It was recorded on Thursday, October 22nd, and so that's on the NARFE website also. And there is more information on the portal also. That's all that I have to report on, unless anyone has any questions.
Thank you, Cheryl.
Yeah.
Well, my report that I sent out, I can't find, so I apologize.
I know it's on email. I will forward it for distribution to our members.
Very good.
I didn't get a chance to look at it myself this morning, but okay. Actually, I'm going to skip ahead a little bit here, and we'll go ahead with the nominations report. And before I do that, I want to thank 2 people for their service. They're not able to continue. One is Don Messer, who has served as our legislative officer, both the for our chapter and as the congressional district leader. But because of family responsibilities, he's not able to continue. And he was on this call earlier. I think he hasn't been able to get back. But he's served in that capacity in the last couple of years. And Susan Rea has served as our first vice president, and including running the meetings during the time that Cheryl and I are out in Arizona. She's done that for the last 3 years, and we want to thank her and recognize her for her service. Also want to thank Judy Pierce for agreeing to be our nominations chair for this year. And I'm going to turn it over to Judy. Back to her. She's
Okay. Tom, first I'll ask, do we have a quorum?
We need 10.
We need 10. How many bodies do we have?
9. 9 up on the screen. I don't know.
But how, are you counting couples like Chaz and I?
Oh, 9. Oh,
Where's Chaz?
11.
He's right here.
Oh,
Right here.
oh there's Chaz.
9.
And Cheryl is here.
11, 12. We have 12 with the spouses.
We have enough because I'm a member. We need 10 members.
Okay, we have
Not
12
just spouses.
with the spouses. Yeah. Okay.
So we're okay with the quorum?
Yes.
Yeah.
Just
Okay,
me.
thank you. So we have a very brief slate of officers to present. Tom Jennings has graciously agreed to continue as president. Jim DeFrance is going to be vice president, and Glenn Marshall is treasurer. They have been willing to continue if we don't have any other nominations. We did not have anybody volunteer for the secretary position. So I would ask at this point if there were any nominations from our virtual floor that will need to be added into that slate of officers. If not, I would ask that somebody make a motion that the nominations be closed. Are there any nominations from the floor? Will somebody make a motion that the nominations be closed?
So moved.
Is there a second for that motion?
Glenn Marshall, I second.
All in favor of closing the nominations?
Aye.
Nobody's opposed? Okay, so then we will take a vote on those 3 positions: President Tom Jennings, Vice President Jim DeFrance, Treasurer Glenn Marshall. If you're all willing, I would ask someone to make a motion that the slate of officers be accepted unanimously.
So moved.
Is there a second?
Second.
Then the slate has been approved as presented unanimously. So congratulations or condolences to those of you who have been chosen.
That's about
And
all.
thank you to all of you.
And thank you, Judy. I would like to just announce the appointed positions, which is one of the privileges of the president, and that does not require approval by the membership. But I wanted to announce them here. I am going to take back the legislative officer position since Don will not be able to do it. I think he will, if he is able to participate, will add his 2 cents worth. He's always very knowledgeable about what's going on in that arena. Fran and Walt have agreed to continue as our membership co-chairs. Jim DeFrance has the additional duty of the public relations officer. Judy again is serving as Sunshine Chair and NARFE coordinator. John Gordon is agreed to continue with Alzheimer's, and Cheryl as our service officer. And I will now call on our Federation president, Henry Bratley, to swear us all in, at least those of us that are on the call.
If you would, all who are officers, raise your right hand.
Okay.
Do you hereby pledge to effectively perform the duties of your office, carry out the programs, policies, and bylaws of the association, promote its goals and objectives, and work as a team in harmony with the association's leadership? Will you safeguard all of the association's property under your care, have such property available for official inspection if required, and pass on said property intact to any successor? If so, please say, I do.
I do.
I do.
I hereby declare you duly installed officers of the Wilmington Chapter 0337, and you will now assume the duties of your office as prescribed by the bylaws. Congratulations.
Thank you.
Thank you, Henry.
And I did find that section, if you can give me one moment. From the end of the first quarter, we have lost 14,000 people nationally. For NC, since May, we've gained 69 members, but lost 112. Our net loss was 43. This is about 0.1% of our total membership. Of the 112 losses, 34 were deaths and 78 were dropped for non-payment or other causes. I encourage you, as you've already indicated you're doing, to contact those who have dropped for other reasons than death. That one's a hard one to bring back from.
Yeah.
But
Need a lot of help for that.
yeah, but the bottom line is that we need to contact those who are leaving and encourage them to continue to be members. Again, congratulations to all of you. Don, thank you for the work you did. Congratulations to Tom on accepting these additional duties.
Thank you, Henry. You're welcome. We would provide you lunch if we were still meeting in person.
I'll put it on your tab.
Right.
Okay. Thanks a lot.
And just one last thing, if Glenn, you would send me the link, or I can send you a download link.
If you could send me 2 download links, we had a little interruption and it got cut in half, so I'll need 2.
Okay. I'll send you that.
All right.
Thank you.
I want to thank Henry for making it possible to have our meetings on YouTube now. You can just go to the Federation website, NCNARFE.org, and pretty easily go to the YouTube section and see this meeting eventually, as well as our September and October meetings are there. And with a really nifty introduction that before our actual part starts. So again, Henry, thank you for your hard work and your capability in creating those kinds of things.
Thank you. Thank you. And it's ncnarf.org, and then go to chapter virtual meetings on the top header. And as you hit that, it will show you all of the ones we have right now for Wilmington, Raleigh, and Durham.
Very good.
Great.
And we're
Thank
pleased
you.
to be in good company with being kind of in the forefront with that. So I'm going to give a real brief update on Federation activities, and Henry may want to jump in and add. We mentioned the incentives that are available. Henry has appointed a new revenue committee. I'm on the committee. We had our first meeting yesterday, and we're going to be Charles Talley is chairing that committee, and we're going to be looking at ways, particularly with sponsorships or ads and so forth, in order to increase our income and revenue. I happened to receive a copy of the Alabama Federation newspaper, and they have 150 plus ads for everything from auto repair, funeral services,
Guns?
a gun shop,
Oh, no.
and alcohol, tobacco, everything. Most of the vices are covered there, I guess. So anyway, so we're kind of going to be looking at some of that. Also, Henry has appointed me to chair the strategic planning committee, and we're going to be looking at some of the structure, the different positions in the Federation. Are there opportunities for further consolidation or streamlining? How can we better set ourselves up to really hone in on our core missions of advocacy, membership, recruitment, retention, and so forth. We'll be having the November board meeting virtually next week on Tuesday, and Henry will be chairing that. And we will be having our annual meeting in May. At this point, we're looking at being on 2 tracks, the possibility at least of having an in-person meeting, most likely back in Hickory, North Carolina, but also with the virus situation, we may well be needing to go to a virtual annual meeting again. Henry, anything you'd like to add from the Federation?
Yeah, with what you've just said, it would be real nice to poll your members who are online as to whether they would prefer a online meeting again or in person.
I think we have to wait and see what the conditions are. You know, at this point, with the high number of coronavirus cases, it's definitely online, but who knows what it'll be. You know, we just heard that Blue Cross is closed till the end of June.
Correct.
So this is too early to make a decision.
Well, it's one of the factors that we'll be looking at on Thursday, next Tuesday, is that very issue, because Blue Cross Blue Shield and the Aetna and GEHA, the ones who come and are sponsors, there would be a significant aspect that wasn't there and may have impact on the cash flow. The other thing is that we had more people show up last year for the virtual annual meeting than we did for the
right
real one. So I understand the benefit of being there and seeing your friends and having dinner and doing all those good things. But we have to look at it, as you were indicating, against the COVID, and then will people attend? If we find out that 50% of the people don't want to show up, then it becomes a very expensive, happy event.
Yeah.
So we will look more. We'll be talking more. I just wanted to get a sense from you folks what you thought. Thank you.
I think we're going to be talking right now about the same issue in terms of our chapter. We had a little visit. Jim and Glenn and Cheryl and I visited our Golden Corral restaurant about a week ago, and met with one of their 2 managers now. I don't remember her name. They are not using the meeting room that we normally would be in. It would be very crowded. It would be, I think, impossible to have social distancing. But if we did want to come back, they would permit us to have that whole outside area that we kind of used in the past at one point. At least while we were there visiting, it was very quiet. They are not having the kind of business that they were having before. It wasn't noisy or anything. There is enough room that we, at least with the number of people we normally have, would probably could do a reasonable amount of social distancing. They have gone back to a buffet style. You have to wear a mask, and they give you a glove to wear for each time you go up to use the buffet. I think they've done everything that they reasonably can to make it safe, but nothing is completely safe, as we know. The other area, they do have Wi-Fi, and Glenn plans, he was not able to do it, but to go back with his laptop and see if a hybrid meeting in there in person with others joining that way would be feasible. See, Bob has his hand up there.
Yeah, I was just thinking if we did want to go with an in-person meeting, what about using I'm going to say Hugh McCrae because I can't think of the new name, but doing it outdoors where people could actually bring chairs and really social distance, and there are plenty of tables, rather than doing it indoor and like bring your own or something if you wanted to do it in person. Remember, we do not have a December meeting.
Right.
January would be cold. Rainy.
It could be rainy, could be weather issues in January, February, and March.
Right.
I would suggest that you all meet in Arizona at Tom and Charles' place.
It comes
That's
out of
good.
it comes out
That's
of
a
the
good-
Federation
It might
budget,
not,
right?
social distancing might be a little hard, although we have a nice backyard there. There'll be plenty of room in the backyard, and it
Yeah.
probably would be sunny, so that is not a. I see Judy. I see.
Tom, I really think with the way things are going and the cases continuing to go up everywhere, I know personally I would not feel comfortable. I know for sure in January. I don't know yet about the rest of the months, but I'm thinking maybe just for sake of knowing what's going to happen, we say maybe January, February, March, we have virtual Zoom meetings. And then when we get into February, March, see how the thing is going, and then maybe have some outdoor meetings, as Bob suggested, in April when the weather's better. But to make the first 3 months virtual, that's just a suggestion.
Agree with you.
I agree too.
Anybody disagree with that?
Do you want me to make a motion? Do we have to vote, or do you want?
As long as you're making a motion, also include that we. Well, we'll come back. Go ahead and make the motion.
Well, I was just going to say I make a motion that we, for the first 3 months of 2021, we have our meetings by Zoom, and as the year unfolds, we investigate other possibilities, either going to the Golden Corral and doing a hybrid, or going outdoors at Longleaf Park, or whatever other options we might find.
Is there a second?
I second.
Any further discussion? Hearing none, all in favor?
Aye.
Aye.
Opposed? Motion carries unanimously.
Well, then we can attend the meetings for
Yeah, right.
the first 3 months.
Yes.
Yeah, we probably can run the meeting. So.
Oh,
Maybe,
aren't you lucky, Tom? You thought you might get away from us, but you
Yeah,
won't.
we have. Every other year I got a little vacation, yeah.
Human hag.
Another.
Thank you all. Makes my job simpler.
Yeah, right. Just to keep it completely legal, we should have a motion to not have the December meeting. We haven't had it.
We did. We did that last month. We
Did we? Okay.
Yeah. Yeah, we did that.
Okay.
That's been
All right,
taken
we got
care
that covered then. Let's see. Jim, you want to talk about our upcoming programs?
Okay, for January, we have Dr. Kyle Horton coming back to us. You know, she spoke with us a year ago or so. She should be able to tell us a lot about the hospital situation and maybe some other things. She's got a lot of good information. February, Bill Sappho is going to meet with us again, and he's penciled us in, even though it's still very early, but he keeps his commitments, so you could probably count on him for February. For March, it'll be Ludi LaPerry. We've had her a few times to talk about the tax situation. There is a tax thing I know about. You know that you're going to be able to deduct up to $300 in charitable donations. That's because of the CARE Act, because of the the coronavirus. That would be even if you are just taking the standard deduction. You might want to verify that with your tax person.
That's good to know.
Yeah, they're not making much of that. The notice is not around, but I did verify that with my tax fella. So
okay, that's great. That's great news. Great information.
Yeah.
Maybe for Henry or anyone else, Bill Sappho is our longstanding mayor in Wilmington, and Dr. Kyle Horton is a former federal employee. She was a VA physician for some time. She ran 2 years ago unsuccessfully for the District 7 congressional seat. She ran this time for the county commission, and from what Jim has told me is she didn't win, but she had a very good showing. And she is very knowledgeable and articulate and has taken a great interest in this issue of New Hanover County Healthcare Center merging with, forgot what, I know it's an outside one. I can't remember right now which one it is. But so this sounds like good programs coming up for the first 3 months of the year.
And of course, the other thing is if you all have other suggestions, just email them to me or call me and we'll talk about it.
It sounds good.
All right.
Is there any other business?
Yeah.
Oh, yes. I'm sorry.
Yeah.
It's on the second page. Go ahead. Salvation Army.
Yeah, well, I guess I'm talking to the choir here because right now there's only one person on the screen besides Henry that hasn't donated to the Salvation Army. And Fran and
you're not going to identify them, are you?
they know who. They know who. I'm not mentioning names, but thank you all. 8 of us did volunteer and send checks, and I already took those to the Salvation Army. We have already donated $391 this year.
Oh, great.
Fran and Tom, since there's so few people on this meeting at this moment, the message I was going to give is we are fortunately the haves. We got paid the beginning of this week, and we'll get paid the beginning of next week. And we are the haves, and at this point, there are a lot of have-nots.
Mm-hmm.
And we used to go to the Golden Corral, pay $9 for lunch. We'd have a $10 gift exchange. Come on, people, give. So, please send out a notice. And I'd like to do another close to $400 for our November meeting. It's a good cause, and as I say, we
will include a strong plea for this as part of it.
And I hope those of you that did send a check to me did get their receipt letter from the Salvation Army. I already got mine.
We did too.
We got one.
And as I say, there's Henry and one other person that didn't get one. But I ain't mentioning names.
Tom?
Yes, go ahead, Judy.
I would make a suggestion that if Fran and Walt are able to send out a separate email about the Salvation Army rather than just including it at the end of the minutes, because everybody, to be honest, may not scroll all the way down to the bottom. And that way you'll get people's attention with a separate blast.
We'll make that a separate.
Thank you. Yeah. Henry, you're invited to join us on this.
Well, as a former preacher, well, I'm still a preacher's kid, but my father's passed away, and I have a number of friends who are in the Salvation Army, so I'm well aware of the benefits and have contributed, but not to yours.
We understand that.
We understand.
But you can if you want to.
Give often and early.
Yeah.
And just to mention lastly that we are also still collecting for Alzheimer's.
Of course.
John Gordon will be happy also to receive a check from you. Can make it out to Alzheimer's research, or I kind of made a mistake, made it out to John, and he just endorsed it over to the Salvation Army. Trying to excuse me.
Tom, on a different subject, I think with this Zoom, it's so easy to go to a meeting, and yet for 2 months in a row, we had like less than a dozen people last month, and really for our meeting, less than a dozen people. And even the people that came on for Patsy bailed out prior to the meeting. I don't know whether our invitation to come to meeting has to be jazzed up or something, but you know, we're going to lose a lot of interest and a lot of follow through if we don't really entice our membership. We have a big membership, and it's terribly disappointing to see the same few people. If we take away the audience, I mean, the 3 officers and the 2 appointed people, there's Bill Guyton and myself are the only non-officer members here. And that
Don't forget Chaz. Don't forget Chaz.
No, I said you're appointed, Judy.
No, but Chaz. I said Chaz. Don't forget
Chaz
Chaz.
is not in the picture, so he's out of sight, out of mind. Okay. You know, move your camera so you show both of us, both of you. Fran and Walt do a good job doing it.
I know they do.
But anyway, we've got to do something to vitalize our group.
Yeah.
What we should do is offer, if they join the Zoom meeting, pay for their lunch when we get back to the Golden Corral.
So we get
That may never happen.
We're here 2 minutes.
Give them a discount.
Yeah. That's maybe that's worth thinking about. I have spoken to some of our people that regularly come, and some people really are not comfortable with trying to do Zoom. John Gordon I spoke with last evening, and he's tried to come in and has an older computer and just couldn't make it work.
You can come in by phone.
And he tried by phone before, and that somehow didn't work for him. Lillian Hurst tried a couple of times.
Well, she was on earlier.
But she never came up.
Lillian was on earlier.
Her name came up, but that's it.
Oh, let's see, I didn't see that, but
Well, we'll do the best we can.
Yeah, I think what we need to do, and we'll take responsibility for that, is contact as many of our members as we can between now and January and see what we can do. And maybe think of an incentive of some sort, just like this. Go ahead, Fran.
I was thinking, since not everyone is so easily able to get online with the computer and so forth like that, perhaps Walt and I can send out some postcards to the membership and just say, we are doing this online. We miss you at the meetings, just kind of to let them know that they are still part of the membership, even though they're not able to get online. So maybe that will help them realize, you know, try to stay connected. Perhaps if they need help getting online, they could contact us or contact another member that can help them. I mean, if we don't reach out to these people, they're just going to fade off into the distance.
Yeah, and that's a reason why we were really thinking about trying to meet like in January. But since that time, since a week or two ago, the virus has really exploded across the country, and so that makes great sense. I'll work with you guys on what we send out to down to about 135 members. So
yeah, but I mean, a postcard doesn't cost that much. And
No.
Right.
we typed up some little thing, a sticker type thing. We could do it on the computer and then just tape the message right onto the postcard. It
it would be maybe one day's work for us to do. We'd be able to do that.
Especially someone that isn't got the computer to begin with, and it's not email.
Right.
They're being left out.
And
Not on email.
it may be for people that are willing to try it that we, Glenn and I could work on another trial session,
If you do send out postcards, send it out after January 1. The meeting is not till the 7th. And with the holidays, people might not really care about it. So send it out so it comes the week of the meeting.
Right. No, that's fine. Yeah, I would send it out at a later time, not right now, because we're going to start having the holiday mail, and we don't want it to get caught up in that, plus all the political stuff that's going on right now, too.
Okay.
Okay.
Are there any other issues for the good of the order?
Just a reminder that there is a training session coming up on AMS for chapter officers, and it'll show you how to create labels using AMS and other things as well. There have been changes to the system, trying to improve it, and it may be worth your time to register.
And do you have the date on that, Henry?
Pardon?
Do you have the date on that?
I will.
I saw it, yeah. We'll include that in the minutes, but I think it's coming up next week. So
Yes. There's actually 3 dates, 2 for chapters and 1 for federation.
Okay.
Well, we'll get that information out to everyone. I guess I will entertain a motion to adjourn.
I make a motion to adjourn.
Yeah. Second.
All in
Aye.
favor?
Yeah.
Aye.
Bye.
Bye. Good to see everybody.
Thank you, Glenn, for technical support. Thank you, Henry.
My pleasure.
Stay safe. Stay safe, everybody.
Yes, stay safe. Take care.